Assalamu alaikum wa rahmatullah. Ya'tikum al-afiyah. Good afternoon, everybody. On behalf of the chairman and the deputy of chairman and his wife too, and the management, the executive manager, and also the medical director, I want to thank everybody that made the presentation last time. We're proud of everybody did or will prepare for the new one. So our presentation today will be about the temporary anchorage devices. I think it's not a common subject for everybody. So I tried just to make it easy and to transfer it to everybody, even for the non-orthodontist, in an easy way. So I brought something like this machine, this instrument. We use it in the off-road off-road adventures. But I'll try just to show you now. We'll start first of all. You see here also the logo. I think everybody knows this anchor for the boat. This is just to make it easy to know the idea. Now we'll start with a movie clip. There's a car here stuck. This is called pull bar. It's for the anchorage. There's a car, and the other car is trying to pull this, pull the other car. See now what will happen. They have to support this car just to pull the other car. Otherwise, this car will go to the other side. So while supporting this car, the other car, here's another car. It wants just to take anchorage to move. They use this machine, this instrument, to get out of the stuck. So it's like this. Just open up, take an anchorage from the sand. It depends on Newton's third law. I'll keep this at the website if anybody wanna order it online. Anyhow, we'll start now. So this is the main idea I'm just presenting. This is Newton's third law of motion. For every action there is an equal and opposite reaction. لكل فعل ردة فعل مساوي له في المقدار أو معاكسة في الاتجاه. We can see here this woman is trying to push the door just to go forward. So there's the opposite reaction on the other side. Even here also the elephant with the man, and also on the wall is trying to take in the opposite directions. You can see 500 Newton also. Next, in orthodontics we try just to get some intraoral anchorage devices. We have this, all the orthodontists know this, we use it daily in most of our cases, especially the extraction cases. We try to catch the posterior teeth connected to the nares. The left one is nares, the right one is lingual arch. We use it on the lower arch. We have also This is the extraoral anchorage devices also. We have the face mask, the headgear. Here's on the left side, this is the face mask. This is a new face mask taking from the forehead, taking the anchorage from the forehead. This is a new one from Dr. Kalash, Dr. Husam. It's a new one. It's from Dr. Kalash, just to treat the open bite without pulling the lower jaw backward. Also here the face mask. This face mask also, it's the easiest one they are using now, because the patient can turn right and left anyhow. What's the temporary anchorage device? Temporary anchorage device, we can say TAD, temporary anchorage device. It's a device that's temporarily fixed to bone for the purpose of enhancing orthodontic anchorage, either by supporting the teeth of the reactive unit or by obviating the need for the reactive unit altogether, and which subsequently removed after a while. هذه الانكورج ديفايسز يعني زي مثل سبورت ندعم فيها الانكورج، ندعم فيها يعني ناخذ فيها الدعم لفتره مؤقته وبعدها بنشيلها، يعني هي temporary بشكل مؤقت بنحطها. اول ما بدأوا when first started this in 1945, this was the first idea got from Gainsforth and Higley. They started doing the temporary anchorage by using that on a dog. Sorry for the dog. Okay, so they are starting with doing on the dog. They used the 2.4 millimeter pilot hole and 2.4 millimeter diameter 13 millimeter long Vitalium screw on dog, as you see here on this picture. This is the Vitalium word here. You said sorry for that. Okay, this is the screw, and this is the tooth, the posterior tooth of the dog. They first started with this, and we have to thank them for this first idea. After that, the first clinical report in the literature was from Creekmore and Eklund. They used Vitalium bone screw to treat a patient with a deep impinging overbite. Even though it was very successful, it was very nice, the result was perfect really, but they couldn't do that because of these three reasons. The lack of widespread acceptance of surgical procedures. كان القبول للأشياء الجراحية ما كان جدا مقبول بالفترة اللي كانت. The second one is unaccepted field of implant dentistry. ما كان لسه عارفين، ما كانوا لسه مقتنعين يعني فكرة الزرع في طب الأسنان. الثالثة كانت scientific data كانت قليلة عندهم. The lack of scientific data on the use of implantable materials. كان في خوف من الأعراض الجانبية أو الاختلاطات اللي كانت ممكن تصير معهم. This is our professor Dr. Nijat Erverdi, Dr. Husam Nuzam. He was always tells us he's the head of the ortho department at Marmara University, and he's the pioneer in the TAD. Dr. Husam knows the Dr. Nijat was always telling us TAD is the future of orthodontics, and we got that from him. TAD, the temporary anchorage devices, is divided into biological one, and we start with biological one. As we see here, the osseointegration, like ankylosed tooth. The ankylosed tooth is the tooth that connected directly to the bone. It's fused to the bone. الأسنان الملتصقة مع العظم بشكل كامل نعتبرها دعامات، نقدر نعتمد عليها بالتقويم وبالانكورج اللي يعني دعم الأسنان، سحب الأسنان الأمامية أو سحب أي سن للخلف، نعتبرها دعامات ملتصقة في العظم وقوية جدا ما بتتحرك. الثاني هو الميكانيكال وان، دي لسرة التيث. بعض الأسنان بيكون في عليها مشاكل خلفية أو في عليها بنقدر نعتمد عليها بشكل مؤقت قبل ما نشيلها أو قبل ما. وعند البايكومباتيبل تاد في osseointegration like dental implant. As you see here, the dental implant everybody knows الزراعات السنية العادية. ونفس الوقت البالاتال implant. This palatal implant we used to do it. We used to fix this one when we were student at the university. We used to do it many times to distalize also as an anchorage, but it's very difficult, not easy just to apply it. It was difficult a little bit. Also we have here also the retromolar implant. We can put the implant at the retromolar area. Here, this area. Behind the last tooth. قبل آخر سن تحت بالأسنان الخلفية. الأسنان السفلية الخلفية. We have the other one is the palatal implant. Implant is just connected. We can just put it on the palate, touching the bone. We can just make a flap, put the implant on the bone, and it will connect to the bone. We can say make osseointegration due to the hydroxyl apatite. It's consists of hydroxyl apatite that connect to the bone biocompatibly. Also we have here the mechanical retention. As we see here, the fixation screws. As you see here, this screw, they use it at the surgery. Always use it. As we see here, they put it open the flap, put the like a plate. صفائح من التيتانيوم او كانوا يستعملوا ستانلس ستيل او صاروا يستعملوا الان معظم التيتانيوم. يستعملوا معها الفيكسيشن سكرو يعني زي مثل براغي او براغي معينه خاصه بمقاسات صغيره شوي وبيثبتوها عليها وبيطلع منها جزء هو اللي يعتمدوا عليه في الانكورج او في الانتروجن او بال. We have here also fixation wires. They used to do fixation wires before the fixation screws. And the last thing is the mini screws. This is the mini screw. What we'll try now to concentrate on. I'll try to pass this to everybody to see the mini screw. It's here on this side. It's screwed completely inside, and on the other side, it's I started only with the two turns. So I'll pass it through. Everybody should see it. This is the mini screw. The mini screw, what we saw now, it can be determined to be titanium alloy or stainless steel. Can be classified according to the shape to a self-drilling and self-tapping. Self-drilling almost it's like